Hello, I'm Walter, middle initial F, Wrenn, W-R-E-N-N, Roman numeral 3, and I'm a medical physician.
Doctor, can you tell us a little bit about the criminalization in medicine? What's that all about?
Okay, I'll start off with my case, and then I'll bring in other cases.
Okay.
On February 17th, 2021, I was arrested at my home and entered the criminal justice system. I was totally unprepared for the events that followed. I learned at a young age that self-pity was a losing pathway. Also learned that to enter into a fight without information or ammunition was equally disastrous. I didn't know where to start. I was contacted by Linda Cheek, MD, an organization, Doctors of Courage. This eventually led me to Norman Clements and other individuals similarly charged. I then investigated over 150 cases of physicians charged and convicted, as well as those awaiting trial. I found two things that appeared to be common in all cases. All were charged with violating the Criminal Substance Act. The Criminal Substance Act was a regulatory act passed by Congress in 1970 to regulate FDA-approved medication that were considered addictive or abusive. These medications were placed into 5 categories and determined who could prescribe, dispense, or manufacture them. The purpose was to prevent individuals not authorized by the Criminal Controlled Substance Act to be arrested and incarcerated. The other theme was the 2016 CDC guidelines. These guidelines were designed to help primary care physicians safely prescribe opiate pain medication in an attempt to lessen the possibility of addiction and or abuse. Unfortunately, state legislatures began to pass laws if the guidelines were laws or that they were proven policy. In 2018, Oklahoma passed a law that opiate pain medication could only be prescribed for 7 days post-operative for an adult and 5 days for a minor. As a result of this law, Preston Phillips, MD, was murdered in Tulsa, Oklahoma by a patient 13 days post-op. If you remember the case, it was 2 doctors, a nurse, and a patient that were murdered in Tulsa, Oklahoma. On June 27, 2022, the United States Supreme Court ruled 9-0 that a physician could not be charged with a crime for prescribing controlled medication they were authorized to prescribe. Immediately, Dr. Kim had 154 charges dropped. Other physicians were not so lucky. In one case, the judge ignored the Supreme Court decision altogether, saying if the decision was followed, other developments of significance, no one will ever be convicted. If the decision was followed, other developments of significance was the not guilty verdict of Leslie Pompley, MD. While not a not guilty verdict, Harvey Jenkins, MD, who was also an orthopedic spine specialist, was allowed to plead guilty and have the 20-year sentence vacated instead of given 20 years probation. Just this past week, Stephen Henson, MD, had his 4 life sentences overturned. Now, my particular case, when I was arrested, I was charged with drug delivery resulting in death and involuntary manslaughter, along with 5 other charges. I had a 55-year-old white lady that I treated for more than 20 years. She'd had surgery on her back. She developed foot drop, which meant she couldn't put her foot up without having a brace, urinary and bowel incontinence. At the time of her death, she had cocaine in her system. Their expert, however, said it was my medication, pain medication, oxycodone and Xanax, along with the cocaine that caused her death. I eventually, on October 20th, 2021, took a plea deal. Why did I do that? That's always bad. But anyway, it was either 21 years in jail and a $45,000 fine, and no jail time and $2,000 fine. So regardless of what they charged me with, I just took the plea deal. On November 10th, 2021, I found out that there was a case being appealed to the Supreme Court. Han and Khan, Ruan rather, R-U-A-N, and Khan, H-A-H-N, being appealed to the Supreme Court. And on June 20th, matter of fact, on March 1st, I listened to the oral arguments. I was really, really enthused. And on June 27th, 2022, the Supreme Court ruled 9-0. Last decision written by Justice Barr. You didn't hear anything about it for some reason. And they said that a physician cannot be charged with a crime for prescribing a medication that they were authorized to prescribe. And of course, that was, in my case, the same case. Now, there are a lot of cases like this that we haven't paid any attention to it because it hasn't reached the main media. For instance, while I was in jail, 2 of my patients I was treating for opiate addiction died. They relapsed, went out in the street, got medication, and they died. I talked to other physicians, some as high as 18 of their patients similarly died. I wrote Merrick Garland, the Attorney General, asking him to put a pause on the case, look at these cases, but they were causing harm. You know, this war on drugs, number one, was lost years ago. That's the first thing. We hear tragedy, but they don't last long in the news. For instance, a black physician who developed COVID in Illinois was asking for pain medication. They denied her pain medication because she died. So did her story. You know, we hear these kinds of little stories all the time. I talk to people, primary care physicians in California, and they no longer will write opiate pain medication. In my particular case, I only had 27 people on opiate pain medication. I had been reducing this group of people for years, not because people don't need pain medication, but because of the hassle around it. And this is before my arrest. And then I also treated opiate addiction. I was a medical director for 2 drug centers in Philadelphia. And I treated them with a drug called Suboxone, S-U-B-O-X-O-N-E, which is the drug for treatment. What happens, though, unfortunately, many people, physicians, don't look at the pharmacology of the drug, realize it has this filling effect. They don't know anything about opioid receptors, so they're not understanding about saturating the opioid receptors, and they don't give them enough medication to prevent them from relapsing. So there's a lot needs to be done in that regard. Unfortunately, only about 5% of physicians actually prescribe Suboxone, and there are some of these 3,000 physicians that have been arrested, with 1,800 of them being black. They have some of these physicians were prescribing Suboxone, and the government charged them with not having a legitimate medical reason. Well, they were treating people that had addictions. That should be a legitimate medical reason. But the government has been able to define the territory. Highly addictive. What do you mean by that? They said, in other words, 30 milligrams versus 5. Well, the physiology of the drug is the same. It goes to the opioid receptors. Once it saturates, it leaves the body. The other things they would call it's highly addictive, over prescribing. How do you tell a physician that they've given them too many pills? That should be strictly between the doctor and the patient. And even pharmacies arbitrarily won't prescribe your medication, you know. So, and then they make up stories like the deadly triad. That's an opiate, a benzodiazepine like Xanax or Valium, and Soma. Now, oddly enough, Soma came with codeine. So the drug has been out for 40 years in combination with an opiate. So if it was deadly, how's it deadly now, but wasn't deadly then? You see, so a lot of this is misinformation. So I've been on several radio programs across the country with my colleagues and telling our story, because, you know, I tell my story because look my name up, should be able to pull it up. It's a matter of public record, because I want people to know the truth. How can you get recourse or get relief if you don't know the truth or know what you're looking for? So that's happened. So we need someone to ask the question: is that story true or is it fabricated? And if true, what can we do to save the lives of people who will continue to use drugs and abuse drugs and continue to die daily? And over our country is the only country in the world where overdose deaths have increased. Why is that? Because in other countries, number one, drugs are not illegal. Number two, if you need heroin, they'll give you the heroin. If you need oxycodone, they'll give you. If you want to go to a treatment center, you don't have to get permission to do it. If you want a certain dose of drug, like a higher dose that you should be on, it's not a problem. You know, so that's how you have clean needle sites. You know, all these things take place in other countries other than this country because we have criminalized medication. I don't know why. Josh Shapiro was the governor of Pennsylvania. Well, he was the attorney general to charge me. So number one, did he do this for political reasons? You know, we have we may have our own opinion. But the thing is that why hasn't my sentence and other doctors like me or healthcare professionals like me, sentence has been dropped? It should be odd enough. Like I said, I'm supposed to hear from the state by September 21st, but they can extend that. They could actually ask for a continuance without even giving a reason and giving a continuance. So we need oversight. We also need the medical profession to step up and say, people on prescription pain medication, by and large, do not get addicted. That's 1%. Most people, if you give them Percocet for their pain, they have a bad reaction, don't like the way it makes them feel, never use it again. Never use it again. So that's the thing. The other thing is, like I said, there's no study that shows that the combination of a benzodiazepine like Xanax or Valium and an opiate causes a problem. None in the world. Not only that, they never will have one, because you can't do a study where a negative outcome might be anticipated. So you're not going to have all these things. So you have to rely so much on your healthcare provider to tell you the truth. You go to him and you say, these are my symptoms. He would say, okay, this could be this, that, or that. We'll run these tests to see whether or not they are, and we'll go from there. Step 1, 2, 3, whatever it takes. And that's what we have to get to. But the criminalization of medicine, like I said, it took my medical license, my DEA license, my passport, made me sign a paper I wouldn't practice medicine anymore, since I've not practiced since February 16th, 2021, and cannot practice. My probation officer denied me permission for me to come to this meeting because they said, why should I be getting continuing medical education credits when I'm not going to practice medicine anymore? Well, I told him about my case. I said, this case is almost over, and I will be applying for my license. I don't know if I'm going to practice again. I'm 82 years old, but I want my license. I earned that. I worked hard for that license. I worked 2 jobs as an undergraduate. I worked two full-time jobs, all those kind of stuff. So I did a lot of work to get this degree. So that's my story.
You mentioned 1%. 1%. Can you reiterate that?
Yes, only 1% of the people given prescription opiates get addicted to them.
So this opiate epidemic,
it's a myth. The opiate it's a lot, and it's designed to make money. Look at all the pharmaceutical companies gotten sued. Opiate receptors were not described until 1972. These drugs were on the market long before 1972. So we didn't even understand the physiology of an opiate. So you take an opiate, it goes to the opiate receptors, they saturate the receptors, they do whatever they're going to do, and then they die out and go out to the body, have to replace them. Now some people, they get, because of the beta receptor, they feel good, immune receptor rather, they feel good about it, and they want to take more, trying to get this feeling again. They never get it again. But now they're addicted. What are they doing? They're fighting relapse. Nobody wants to go through withdrawal. So what they're taking this medication for is not to get high, as people think, but to keep from having a relapse and getting sick, nausea, diarrhea. People have died in jail and sign them out at dehydration when they died. They did die from dehydration, but it was because of the drug and withdrawal. Had they been given something like Suboxone while they were in jail. Now, even though some people now, if they go to jail and have an opiate addiction, they'll give them Suboxone. They don't give them enough. Let me give them just one tablet so they don't complain maybe. So we need a lot of research. We need some clinical trials because we need to know the facts. You want to know the facts of the best treatment. We know the facts of the best treatment for congestive heart failure. How come we don't know facts of best treatment for addiction, opiate addiction? So we should know that.
So last question, what can just the everyday person, how can we help in this fight?
Well, it's called, how do you make it aware? Can you, do you make contact me? I can give you my email because it's going to take some legislation in order to do this. It's not going to happen by itself. Yeah. If it's someone very important has to die, right? Who the hell cares about Hunter Biden and his problems with the government? Nobody. But it's front page news. It increases viewership. But someone has to die. So my email address is wfwiiique@gmail.com. I'll repeat that. WFWIIIQUE@gmail.com. And my phone number, 215-237-4933. That's 215-237-4933.
Well, man, thank you so much, Dr. Wrenn, for sharing this and bringing light to this. Something that I think most of our viewers had no idea about, but it's something that is as important to us, and we need to get behind it. So
Right.
thank you so much. Yes, sir.
I appreciate it. Thank you. Thank you very much.
Thank you.
Okay.